and thank you all for joining and giving us this opportunity to launch our company today. I would start by first discussing the need for this kind of service in India. Almost over 1 million patients are traveling abroad every year to seek medical treatment for complex medical conditions, rare diseases, difficult diagnosis, and for privacy reasons. Apart from those, there are approximately 4 times more patients who would like to travel or get an expert medical opinion from physicians abroad if they had the resources available. And then there is also a certain perception that the treatment abroad is better, and right or wrong, but that perception does exist, and so sometimes that creates the opportunity. Are my results accurate? Which type of treatment is best? Do I need surgery? We all, I think, go through these kind of questions in our heads. And my American doctor's goal is to provide the latest treatment plan to Indian patients in India using the technology. We plan to collaborate with the physicians and hospital healthcare systems in India. Indian healthcare systems and doctors are comparable to anywhere in the world, the best in the world. Sometimes patients just need the reassurance that the treatment being provided to them by their Indian healthcare system and the doctor is the right treatment, and sometimes the treatment plans needs a small tweaking. Our goal is to provide the reassurance without dislocating the patient from the comfort of their home or their healthcare system and their current care provider in India. I wanted to share some data, clinical studies that have been done on second opinion consults and how they can help improve the outcomes in patients. So this first study is about histopathological diagnosis and pathology, and this is a Japanese study. And in this study, they showed that approximately more than 50% of the cases, there was a change of diagnosis after obtaining a second opinion expert consultation. And this was a study of about 270 patients, so it's a good size study. This is a study from Journal of Clinical Oncology, which showed that the second opinion consultations there was a significant change in management of the patients. In this study, there were close to, I think, somewhere between 300 to 600 patients in 2 different separate arms, and there was a treatment change in more than 50% of the cases. And if you look at the highlighted section over here, the most complex type of cases, stage 4 cancers, there was approximately 57% of the patients who had a change in treatment plan after having a second opinion. Then there was approximately 20% of the patients over here who had a major change in treatment, and approximately 30% of the patients had a minor change in treatment. So approximately 50% of the patients had a change in treatment. My own mother had a diagnosis of early stage breast cancer back in 2018, and my sister is a pathologist in India over here, and we actually needed 2 or 3 opinions, and the treatment plan changed after every opinion. So it took a lot of advice and opinions to get to the right treatment. So I'm sure all of us sitting over here have our own version of similar stories. This is a study from Mayo Clinic, pretty much saying the same thing that we discussed earlier. Approximately 26 to 50% of the patients had a decrease in the diagnosis error after second opinion, and in certain cases they also did third opinion and decreased the error rate to less than 16%. What I found interesting in this study was there was approximately 1 in 5 patients in this study that had a completely different diagnosis after the second opinion. And approximately 9 out of 10 patients had either refinement of their first diagnosis or a completely different diagnosis. That makes it 87% of the patients either had a change in diagnosis or a new diagnosis. Who we are, like Dr. Gundam Raj said, My American Doctor is an American company founded operated, and owned by US board certified and trained physicians to address this exact need that we are discussing for expert medical opinions globally. And we aim to bridge the gaps in healthcare access by offering secure and accessible telehealth services. Our leadership team, you already heard about Dr. Rajan Garg. He is the CEO and co-founder, and he's an expert in emergency medicine, practicing nationally and internationally for quite some time. Dr. Deepak Thomas, he's our Chief Medical Officer and co-founder. Dr. Thomas is an experienced cardiologist with a specialization in nuclear cardiology and cardiovascular imaging. We have Dr. Rishikesh Ganikar. He is our COO and an experienced nephrologist based in Illinois with over 25 years of experience of managing kidney diseases and hypertension. And then we have Dr. Suresh Reddy. He's our Chief Technology Officer, highly experienced radiologist physician, known for his exceptional care in diverse healthcare settings across the United States.